Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on the COVID pandemic. And Dr. Bogan will fill you in more detail, but during the last week, we've seen again the numbers have kept very stable. The spread of new cases that have tested positive has remained in that 4, 5, 6% range, which much better than we're seeing a month and a half, 2 months ago. The cooperation level of the community has been really, really good. So thank you all for keeping wearing your masks, keeping the distance that the health professionals are advising, staying away from indoor congregate settings with a lot of people. So all of those things have been very good. As we know, though, we're heading into the season where things change a little bit, not just the weather, but the activities. Youth's going back to school. School activities both within the classroom and the extracurricular activities, sports among other things. The college is heading back, and if most of the college students are back right now on campus and off campus, and we know with 85,000 students in Allegheny County, it just adds more people and more potential for spread. So again, the college university presidents and their teams have really put out some very good plans, and they've been very strong about enforcing some of the things that they have seen that may lead to some spread. So all of us it's cooperation. It's really all of us working together to continue to do the things we know we can do. And again, I remind every week that there are 2 civic engagements that also can be done very remotely in keeping us safe. One is the census. The census is so important. We have another few weeks until the census data collection will be done. You can do it online. You can do it by phone. And there will be, if you haven't done either one, there will be someone coming to your door, identified with a badge on their, on their shirt. Please, you can stay away from them. They'll have their masks. They'll keep socially, physically distant. But we do want to make sure we get everybody counted. And the second one is voting. We know we have an election coming up in a couple of months. We've made it very easy for people to vote by mail with the application is being sent to every single voter, every single registered voter in Allegheny County. You can register online. The pre-addressed envelope with the pre-addressed postage is there. So again, it's one other activity that people should be participating in, but we want to do it as safely as we can. So with that, let me turn it over to Dr. Bogan to give us the weekly update. Dr. Bogan.
Thank you, Rich, and good afternoon, and thank you for joining us. As the county executive mentioned, our case numbers have remained relatively low this week. University students have returned to the county, and we are working closely with the local institutions to track cases of COVID-19 on their campuses. Like other cities, we have seen some cases here from our university population. One challenge we're having is that some students are using out-of-county home addresses rather than their local address when they get tested. And when they do that, we at the health department are not notified of the results, delaying our ability to conduct case investigations and contact tracing. We have asked all of the institutions to address this on their campuses, and I'm personally asking students to please use your local address when you get tested for COVID-19. Thank you. Overall, we are reaching cases effectively and efficiently, and most cases have provided us with their close contacts, so thank you all. I am concerned about a report on the national news that scammers are posing as contact tracers from health departments. It makes me quite angry that people take advantage of others' vulnerabilities, making the public skeptical and making it harder for those truly performing this essential task of contact tracing. Here are the facts the public should know. Our contact tracing team from the health department will never ask you for your Social Security number. We will never ask for any financial information. We will never ask for your bank account or your credit card. These are all red flags if you get asked those questions. We will ask you for your name spelled correctly, your email address so we can provide more information, and your mailing address. We'll inquire about your health and if we can help you with any resources. And we will ask your permission to enroll you in our contact tracing software called Sarah Alert. If you are asked about money or any financial information of any kind, please hang up and notify your local police. This is not the health department calling you. Over the past several weeks, we've been monitoring clusters and outbreaks identified through case investigation. Some have stayed contained to a particular facility, work site, team, family group, or friends, but others have spilled over into the community. In one cluster, we have linked at least 40 cases together in a web of exposures. And this worries me that we will repeat what happened in late June and early July when we saw how fast the virus can spread. On June 17th, we reported no new cases. 10 days later, we reported 90 new cases. Within a week, we had doubled, and on July 14th, we reported more than 300 cases. The surge and the current clusters remind me and should remind all of you that COVID-19 is a virus that can spread rapidly if we let down our guard. We will continue to struggle to contain this virus until we have effective treatments and a vaccine. As a pediatrician, I have great confidence in vaccines. I personally experienced the change in medical care that resulted from some of the newer childhood vaccines, including those to prevent pneumococcal, Haemophilus influenza type B, hepatitis A, and rotavirus infections. Vaccines save lives and reduced healthcare costs. One study estimated that vaccination with 7 of the 12 routinely recommended childhood vaccines prevents an estimated 33,000 deaths, 14 million cases of disease in every birth cohort, saves $10 billion in direct costs in each birth cohort, and saves society an additional $33 billion in costs that include disability and lost productivity. Before coming to the health department, I conducted clinical research, and my own children participated in clinical research studies. It is absolutely vital that we have well-designed and well-managed clinical trials to evaluate the safety and effectiveness of vaccines and medications. So based on my experiences with vaccines as both a mother and a pediatrician, my experience with clinical research, and my sincere hope and desire for an effective and safe vaccine against COVID-19, I volunteered to participate in a vaccine trial taking place both across the country and locally through the University of Pittsburgh and UPMC. On Monday, I voluntarily consented to participate in the Moderna vaccine trial. As part of the trial, Dr. Judy Martin and a team of nurses and staff determined that I met study entry criteria, reviewed the consent form with me thoroughly, and answered all of my questions. They completed questionnaires about my health. They conducted a physical exam, obtained a nasopharyngeal swab, and collected blood. Finally, I received an injection that was either the vaccine or placebo. I don't know which one I received. The researchers conducting the study don't know which one I received. And I'll get a second shot in about a month. And I will not find out until the study ends which I received. Other than a sore arm, I feel great. Over the next 2 years, I'll be monitored. I'll return to the clinic for follow-up appointments. I'm going to give lots of blood, monitor my health for symptoms of COVID-19, and hopefully help researchers determine if this is an effective vaccine. There is at least one other vaccine trial starting in our area over the next few months, in addition to the one already underway. And researchers need about 750 people to participate. I encourage people to consider volunteering. It is essential that we get wide representation in these clinical trials so we know if the vaccines work well in all people. I want to help be part of the solution. And like all of you, I want to visit with my brothers and sisters. I want to resume travel, hug friends when I see them, and work and think about issues beyond COVID-19. But until the vaccines are tested and available, please remember to keep one another safe by wearing your masks properly over both your nose and mouth, keeping physically distanced, washing your hands, limiting outings, and also please remember to take care of your health by eating a healthy diet, getting physical activity, and attending to your mental health in whatever way suits you. So thank you, please stay safe, and be kind.
Our first question is from Public Source. With the CDC reporting COVID cases among those younger than 18 steadily increasing from March through July, what steps is the health department taking to mitigate the county's positivity rate with students returning to campus?
So as we've discussed before, we've worked very closely with the universities. They've all taken lots of steps to work with their own campuses to limit the spread, and they've been doing lots of messaging. We continue to do that messaging, and I continue to ask people, again, to be part of the community and to keep one another safe by limiting crowds, keeping 6 feet apart, washing your hands, and doing all the things that we know reduce the spread of this infection. Because again, as a young person, you may not have a very serious impact of this. You may not feel that sick, but when elderly and other at-risk people get this infection, it can be deadly. So I ask that you just be part of that effort.
This next question is from the Tribune Review. Governor Wolf's administration updated his guidance for school-sponsored sports today. Specifically, the line prohibiting spectators was eliminated. What does that mean for Allegheny County schools? The joint statement released with the WPIAL and the Health Department had said that spectators are prohibited.
So I'm going to remind people that the way each school district put together their own plan based on the governor's guidance, and school districts would need to follow their guidance from the state. And so, do you want to answer any more about that?
Yeah, let me just, and I think, following up, Dr. Bogan said it very well. The state has eased, if you will, the restrictions on people going to school activities such as sports. We're going to be reviewing that. Dr. Bogan and her team will be reviewing that. Regardless of where it goes locally, we still want to make sure people follow the guidance. This isn't just like open up the stands and everybody come rushing back in. All the distancing, the masks, all those things, we want to keep these activities going. We want to keep these activities safe, and the only way they happen is if there are allowed fans on both sides of the field and those type of things, that people follow the guidelines, stay distant, be respectful, do all the things we know we want to do. Because so the more we cooperate, the more activities and the more openness we can have. Okay.
This next question is from KDK Television. With the weather more likely to turn to fall and winter over the next month, is the county talking with the state to loosen any of the indoor restaurant capacity limits, since most places won't be able to utilize outdoor seating?
Yeah, some of those discussions have been had. We've seen the numbers be stabilized, as Dr. Bogan, and you've seen on the daily reports that come out. I think, my sense is in talking to the state that they do want to see the results of school returning, both at the collegiate level and at the K through 12 level, with all the school activities that we've been talking about. Knowing where that all goes, I'm guessing around the middle of the month, probably in the next couple of weeks, they can take a look and see if there can be, with weather changing, into October and November, more of a relaxation, indoors. But we also know that indoors eating in a restaurant is one of the most likely potential spread activities we can have, when people take off their masks, or sitting down for a long period of time, eating, drinking, etc. So, but those discussions are had, and we're hopeful that the numbers can stay stable. We hope with the returning of school that we can see levels stay where they are.
This next question is from WTAE. Has the county gotten any guidance regarding the distribution of a COVID-19 vaccine when one is approved? And are there any concerns about where things stand with vaccine distribution right now?
Those discussions are really just starting to take place with the state. I have a call coming up. So we have plans, based on flu and the flu pandemics. So those plans will be adapted to distribute the COVID-19 vaccine when it becomes available.
This next question is from WESA. Can Director Bogan explain any recommendations from the county regarding traveling? Should residents quarantine for 14 days after returning from a trip, or just specific hotspots? And what is the county's guidance for people who cannot take an additional 14 days off of work?
So I think I've said this before, travel is complicated. People go on all different kinds of trips. I encourage people to use common sense, right? If you are taking a car and you're going into the woods and you're by yourself for 2 weeks on a vacation or a week, that is very low-risk travel. You're not likely to bring back COVID-19. If you traveled on multiple airplanes for long periods of time, you visited bars in some high-risk states, that's a very different exposure. So people need to use their common sense. I know the CDC guidance is changing. I ask people, again, if you think you could have been exposed, you can go get tested and make sure you're safe. But again, test is just one period of time, and the incubation period of this virus can be quite variable. So if you did high-risk travel, please try to limit your exposure to other people so that we're not spreading it. But very specific guidance is challenging because everyone's travel is a little bit different.
This next question is from the Pittsburgh Business Times. Can you discuss the efforts to date to address the racial and ethnic disparities with COVID-19? What has been successful, what hasn't been successful, and what would you like to see happen in the next several months to make progress?
Yeah, that's a really important question. I think what we've done a really good job is describe the disparity at this point, and we know it exists. What we've done effectively is to get testing into our communities of color. Again, the tests that we've been using at the federally qualified health centers are reaching communities of color. We're doing a lot of outreach effort, but beyond just describing the problem and getting testing, we really need solutions on how do we prevent the spread in our communities, and that's through good outreach and education, which we and many organizations in town are working on. I've heard from lots of organizations that are putting out important and great messaging. One of the challenges is that our low-income communities live in multi-generational homes. They may have higher rates of use of public transportation, and they also work in frontline jobs. And so we need to really work on making sure everybody who needs personal protective equipment has it. And these are ongoing efforts that we need to all continue. And it takes more than the health department. It takes working across organizations, all of our communities, to really make that effort. The health department is just one piece, and we are working with organizations, but I know lots of organizations are doing their own efforts as well, and we appreciate that because, again, this is really a community-wide effort to reduce those disparities and prevent the spread of the virus in higher-risk communities.
And this question from WTAE, does the county's limitation of 100 people in outdoor events and gatherings still stand? And if so, what's the process of how the county would determine whether to ease those restrictions moving forward?
So we have not, so yes, that 100 gathering still stands. We have sort of been waiting, much like the state is waiting on deciding about various things. You know, the return of school and universities made us cautious to make sure that we are not going to set ourselves up for closing those down because of a huge surge in cases. And what we really want to do is keep everybody safe, limit the spread in our community, and by limiting the numbers of people who gather at any location, we hope to be doing that. We continue to revisit our orders and see if we can lift things, but again, right now it really depends on what we're seeing in the next couple of weeks.
And this final question is from Public Source. Does Dr. Bogan worry the county will see a spike in cases following the Labor Day weekend? And if so, are there specific precautions that you're recommending or would put in place for the holiday weekend?
I do worry. I don't know if you recall, but our last surge happened over the 4th of July weekend. My team and I were discussing sort of the fact that nobody in the health department actually had any break over the 4th of July weekend. It was one of our busiest weekends. So we're hoping not for the same on the Labor Day weekend. And again, when we do see a surge, it tends to be 2 to 3 weeks after events. So again, schools returned a couple of weeks ago. We're watching really closely. People want to get out. I encourage people to get out into fresh air, do physical activity, and do all the things that we would do on a weekend, just modified to be cognizant of what's happening with COVID-19. So you can still go to a park and sit physically distanced, have a picnic with friends, go on your bike rides, but again, wear your masks while you're outside and enjoy the beautiful late summer, early fall weather we've been having. But yes, the answer to the question is yes, of course I worry. I think that's part of my job. I'm hoping that with everybody following sort of good common sense that we will not see a surge after the Labor Day weekend.
And that was the final question. If there's any closing remarks.
Well, thank you, Dr. Bogan. And, as we come to the end of traditionally the end of the summer, Labor Day is the kind of the official end as we've seen over the years. This has been a summer like no other. And we'll be entering a fall like no other after we had a spring like no other. But I think, again, the level of cooperation that we saw, particularly when things started to get a little bit bad in early June, or excuse me, in late June, early July, after we went into the green, I think we all learned some very good lessons about how quickly this virus can spread and how quickly positive tests can go up, and then the other ramifications that come along with that. So, as we enter this big weekend with Labor Day, people are going to want to be again with family and friends. Certainly do it in a responsible manner. Be outside, keep your distance, wear your mask, all the things that we've been learning about and what we can do. We want to continue to have as many things open as we can, as many activities as somewhat as normal as we can do, and that only happens if people are wearing their masks, keeping distance, cooperating, and doing all the mitigating strategies that we've been told. Again, I want to thank the governor, Secretary Levine, and Dr. Bogan. When you look at what's going on in other states and other locations in this country, particularly dense urban areas, what we've been able to do here has been much better. And again, it's not perfect, but when you see what's happening in some of these states that have had these tremendous spikes and unfortunately very many fatalities and hospitalizations from it, our level of cooperation, what we've been able to do here in Pennsylvania and in southwestern Pennsylvania and Allegheny County is to be noted, and we all should be very proud of that, but we still have a lot of work to do. Along those lines, like Dr. Bogan, I am participating in the vaccine trial as well with Dr. Martin. I got my shot today. My arm's not sore yet, so I may see that, Dr. Bogan. But I think anybody that can help out and be part of the finding a cure and a vaccine for this, we owe it to ourselves and we owe it to the community to try to do that. So we're proud of our healthcare professionals here, the researchers, the people who have been working for many years with many breakthroughs. Obviously, this is one that's top of mind for everybody in this region and across the country and across the world. So everybody, again, wear your mask, stay safe, God bless, have a safe week and a safe weekend. Thank you.